Hi, everyone. My name is Taylor Carroll, and I'm the nurse practitioner at KSB in the Gastroenterology or GI department. Thank you for joining me about our talk today. We are going to be talking about constipation and prevention, things I can do to help it, when should I see a provider, all common questions that I encounter in practice. If you have any questions or comments that you would like to be addressed, you can leave them below, and we will certainly try to address those. So to start out, the most common question I get is, what is constipation? In general, the definition revolves around how many bowel movements a week you have, how many bowel movements you have per week. And in addition to that, we also take other symptoms into account. If you have some pain with your bowel movements, if you have bloating with bowel movements, or if you feel what we call incomplete evacuation, which is the sensation that you're not done having a bowel movement. If you have excessive straining with bowel movements, those can all be considered in the definition of constipation as well. What causes constipation? Constipation is a very common condition. It affects roughly 63 million people across the nation, and something that we encounter on a daily basis. It's common as we get older because we have decreased intake, how much we eat per day, and calories, food, water, those all go into how we make a bowel movement. Those will give us the size of the stool. So in general, decreasing how much you eat, decreasing your water intake will decrease the number of bowel movements you have. There are some other causes of constipation as well. There's idiopathic, meaning the definition of idiopathic means it's happening, but there's no cause for it. So in general, if your colon is just kind of a slower colon, it's just the way your body is made, that can be associated with constipation. There are some other causes like medications. Common medications that can cause constipation are antidepressants, opioid pain medications, iron supplementation can cause constipation. There are some chronic illnesses that are associated with constipation. Hypothyroidism, Parkinson's disease, diabetes, and pregnancy are also associated with constipation. How to prevent constipation. So back to kind of the beginning of the talk, make sure you're eating enough fiber per day. The recommended amount of fiber is 25 to 30 grams per day, and the average person eats about 14 grams of fiber per day. So only about half of what we should be eating. And make sure you are drinking enough water per day. In general, we like patients to consume only water. A benchmark could be 500 milliliters per day to drink. There are some medical conditions in which your water intake needs to be monitored, but if you have no underlying illnesses or diseases, about 500 milliliters per day would be helpful. If you have a hard time getting enough fiber just through a whole foods diet, you can use a fiber supplement like Metamucil, and the directions are on there. We usually recommend 1 tablespoon in 1 glass of water per day. And this isn't a question that I always receive, usually just because somebody has already come in to be seen, but just for your information, when should you see a provider about your constipation? If you feel that you chronically have constipation and you just feel like it could be better controlled, you're not sure what else to do for it, it interferes with your daily life, you can see a provider and see what recommendations they have. Or if you have a sudden change in your bowel habits, if normally you have a bowel movement every day and you all of a sudden are experiencing severe constipation, that would be a reason to present to a physician or APP office to be seen. And if you develop any associated symptoms with the constipation, if you have some new abdominal pain, if you have some new bleeding with bowel movements or blood in your bowel movements, if you have new weight loss that you're not trying to lose weight, but you're noticing you are losing weight without trying, those would all be reasons to be seen by a provider and have evaluation. So that is kind of the end of the questions that we usually receive. If you, like I said earlier, if you have any questions or comments that you would like to be addressed, you can leave them below. To be seen by KSB Gastroenterology, we usually like a referral from your primary care provider, so you can see them and have them send a referral to our office. We will call you to get scheduled. Or if you would like to call our office with any questions or inquire about an appointment, you can call our office 815-285-5843. Thank you.